Dr. Sarika Chopra, based in Jalu. Do you know that our state, Rajasthan, is not in the pink of health? Yes, we are not in the pink of health because according to WHO dashboard, it is seen that the prevalence of anemia in women of reproductive age in India was 53% in 2019. The fifth highest globally, the latest report of National Family Health Survey 2019 reports that the prevalence of anemia has increased across the India amongst the women and children. What is anemia? Anemia is a condition in which the number of red blood cells or the hemoglobin concentration within them is lower than the normal. It is estimated that the 1/3 of all women of reproductive age are anemic. What is the risk factor behind the anemia? Conditions that may lead to anemia include like heavy periods, pregnancy, ulcer, diet that doesn't have enough iron, folic acid and vitamin B12, blood disorders, problems with iron absorption. All these can cause anemia and all these are risk factors for the anemia. Commonest type of anemia is iron deficiency anemia. It happens when you don't have enough iron in your body. Iron deficiency is usually due to the blood loss, but may be due to poor absorption of iron as well as due to increase in demands. Deficiency in folate, vitamin B12, and vitamin A are also common cause of anemia. How we can diagnose the anemia? Diagnosis of anemia is mostly done by the CBC, complete blood counts. It's measure your red blood cells, hemoglobin, and other parts of your blood. Your doctor will ask about your family history and your medical history after the CBC. What is the normal hemoglobin levels? Hemoglobin normally should be more than 11 gram per deciliter and should be more than 12 gram in non-pregnant women. What's the use of hemoglobin? Hemoglobin is needed to carry oxygen and it makes sure our body gets enough oxygen in every part. What is the symptom of the iron deficiency anemia? Sign and symptom vary depending on the cause and the severity of anemia. It may be fatigue, weakness, dizziness, pale skin, and shortness of breath are the few most common symptoms of anemia. This happens because of too few or abnormal red blood cells or not enough hemoglobin that decreases the capacity of the blood to carry oxygen to the body tissues. Clinical examination can include, we can check the eyelid for pallor, tongue, nail beds, palm, and it is other. What is the pica, the eating disorder, in which there is a appealing desire to lick or eat non-food items such as gypsum, chalk, soil, ice, paper is prevalent in pregnant women and even in adolescent women also it's more common. And in Rajasthan it is more common because girls have a habit to eat these type of non-food items. And what is the consequences of anemia during the pregnancy? Maternal because of anemia, there are 18% of perinatal mortality and 20% of perinatal mortality in South Asian countries, including India. Iron deficiency anemia can have a consequence during pregnancy as well as during lactation and after the delivery. It can also impact the fetus and the neonate, and during labor, it can also impact badly. And if the hemoglobin level is less and the PPH occur during the labor, mother have a serious consequences and she can go in shock. And during pregnancy, iron deficiency can increase the risk of preterm labor, delivery, high blood pressure, intrauterine death, infections, bleeding during pregnancy. And during labor, it can prolong the labor, increase the rate of operative delivery and induce labor, fetal distress, problem related to the placenta. All this can happen during delivery if the mother have an anemia. After the delivery, there are risk of excessive blood loss, infection, failure to produce milk, depression, slowing of process of uterus involution, the slowing of the process of involution of uterus, resuming its original shape. Anemia in mother can impact the baby as well. The baby could have low birth weight and have increased risk of infection, anemia, and the abnormal cognitive disorder developmental. What is the importance of breastfeeding? Now I will tell you about the what is the importance of breastfeeding. Breastfeeding should be exclusively for 6 months and continue till 2 years or more, if possible. Breast milk is the most natural and perfect food for normal growth and healthy development of the infants. And the first milk colostrum is the rich in nutrients and anti-infective factors and should be fed to infants. Breastfeeding reduces the risk of infections. It establishes mother-infant contact and promotes mother-child bonding. It prolongs birth interval by fertility controls. Breastfeeding helps in retraction of the uterus. Incidence of breast cancer is lower in mothers who breastfeed their children. Breastfeeding is associated with better cognitive development of children and may provide some long-term health benefit. A healthy mom can make a healthy baby. Lactating mothers should be supplemented with required nutrition to fulfill their own needs and need of feeding baby through the healthy breast milk. That's why she needs more nutrition during lactation. An ideal formulation containing the optimum protein milk, adequate vitamins and minerals during pregnancy and lactation positively affect overall growth and development of the newborn. Mineral, vitamin requirements are met by consuming a variety of seasonal vegetables, particularly green leafy vegetables, milk, fresh fruit. Though it is possible to meet the requirements for most of nutrients through a balanced diet. Pregnant and lactating women are advised to take daily supplement of iron, folic acid, and vitamin B12. It is. That's why a diet plan for pregnant women and lactating women is very necessary. A diet plan for iron deficiency anemia needs to include a healthy balance of iron-rich food such as meat, poultry, seafood, iron-rich vegetables, nuts, seeds, and beans. It is also crucial to include foods that can improve the body absorption of iron and avoid foods that may interfere with this process. Is it necessary to take iron tablet even after the delivery? This is the most commonly asked question of women after the delivery. I have taken the medicine in whole pregnancy. Should I continue now? Yes, all women should need to continue the iron tablet after the delivery. Prevalence of postpartum iron deficiency anemia is very high in India. Untreated iron deficiency anemia during the postpartum period is a cause of maternal morbidity such as tiredness, lethargy, dizziness, and headache, lactation failure, and postpartum depression. And the maternal mortality rate are also significant. National Iron Plus Initiative recommends iron and folic acid supplementation every day for at least 100 days starting from the first trimester at 14-16 weeks of gestation for all non-anemic pregnant women, followed by the same dose for 100 days postpartum. Some national bodies are also recommending daily iron with folic acid for all non-anemic women in postpartum period for 6 months. Whereas the same tablet is advised to be taken twice daily for mild to moderately anemic postpartum women. Generally, the anemia in postpartum represents a dire need for iron supplementation. In such anemic patients, parenteral iron supplementation can also be considered. One take iron tablet. Avoid taking iron supplement along with the caffeine containing drinks like coffee or tea, milk product and antacid. High fiber foods such as whole grain, raw vegetable eating. Uh, so we should, every woman should avoid taking iron supplementation with these products. And take your iron supplement with a glass of orange, lime, or lemon juice, as prescribed by the doctor in the appropriate dose at appropriate time, with a small amount of food or at bedtime if they upset the stomach. Remember to take your iron supplement. Keep them your in purse or car or at bedside, so you will not miss your iron tablet. Or you can keep your reminder in your mobile. Keep them. If you miss a dose, take it as soon as you can. If it is already time for your next dose, keep the missed dose. It's not like if you miss one dose, you can take two tablets because it causes a little upset to the stomach. So you should skip the dose. If you have missed the dose, you should skip that dose and you should continue with your regular dose. In case of the side effect with the iron supplement, inform your doctor if you experience if you experience nausea, vomiting, constipation, diarrhea. Inform your doctor. Doctor will change your iron tablet brand. It can be replaced by the syrup or IV iron dose and etc. Black stool are normal, but if they are accompanied with the blood or cramps, talk to your doctor. Do not stop taking any medicine without informing your doctor. Remember that you and your baby need to be healthy. Take your iron supplement and be in the pink of health. Thank you for listening me.